Okay, so I work at Riverdale Behavioral Health Services. So we serve a client population from children all the way to adults. I have worked with the children psychiatric unit, the adolescent psychiatric unit, the adolescent sex offender unit, the adolescent chemical dependency unit, adult chemical dependency unit, and geriatric psych. So throughout my career at Rivendell, I have had the opportunity to work with lots of different diagnoses, particularly borderline personality disorder. That was the primary diagnosis we were seeing on the unit that I worked the most. And I have extreme experience in DBT because that was made by Marsha Linehan, who was diagnosed as borderline personality disorder. So that's probably where I have the most experience. I also had the pleasure of working with special needs population intellectually, and so I was able to open a special needs unit, which was mainly dealing with the diagnosis of autism. So I had a hand in that. I got to see a lot of the signs that we talked about, and have worked with the treatment team, given the symptoms or the patient reported and the signs that we're seeing to work with other diagnoses. So recently in my internship, I've had more experience with hands-on working to identify the diagnosis, with doing psychosocials, gathering information, and talking to my supervisor to identify which one it is. The struggle that I think that I've experienced the most is that some of our clients are only here for a matter of days. And so they may come in with a pre-diagnosis that we can, gather information based on and look at. But as far as, maybe to update that and give further treatment, it is a little difficult with the time that we are given because we are an acute facility. Another one of the big hurdles that I've experienced is working with children, ages anywhere from 4 to 11, even above that sometimes, where it can be extremely hard to identify a diagnosis based on what we're seeing. ADHD, we get a lot of that, and sometimes, we feel that diagnosis is appropriate as well, but sometimes it's really hard to see in a couple of days a baseline from a 5-year-old whose behavior may appear ADHD just based on age-appropriate behavior. Another difficulty that I've experienced is seeing the schizophrenic diagnosis in the past. But again, you really can't diagnose that until an older age now. So that's another hurdle that we've experienced in the past that we're kind of clearing up now is, that's not a diagnosis that's appropriate for that age. So figuring out what that could be instead. So I feel like I've had some decent experience with diagnosis, but mainly more experience with the mental health and seeing the signs and the symptoms reported to me. All right, thanks.